I did.
Oh, yeah. And I stuff that's in whole, I don't put on a bacteria, right? Right.
Say it one more time.
The stuff that's in whole, I don't put on a bacteria.
Correct. Yeah. What are the questions you have? We are doing an inguinal hernia on the left side. Okay. You have the picture of your Mayo stand or no?
I do.
You do, okay.
We're not gonna be able to touch it now.
Well, I know, I'm going to help you get to that point. So when we get to that point, we just pop it up for you. And so, well, it's so dark. So, for me?
No, it's me.
Okay. No worries. I'll help you along. Okay. Just get to the point where you set up, do it right, do it thoroughly, get for a count. And once we're done with the count, we'll work on that, okay? You can open up whenever you're ready. Mask up, we are opening up. You guys can commence if you guys are good to go. Yeah, and Cheskar, I'm watching you. All right, patients in pre-op. We're doing an inguinal hernia, open. You're fine, that's still. So when stuff falls like that and it's in a wrapper, yeah, I know it's not normal like that, but if it falls, we're just considered this contaminated. Yeah, we'll get no. But since you're here, we're just gonna put that. Are you gonna use this as your count? Okay. We're just gonna start it. You're fine. So you can come over here and just kind of come like this, because this side is not sterile, but if you want to pull that down, you're fine. You can always bring it down, but you can never go back up, right? And just looking at that, you did great. Just obviously look at this side, it's not as much. Yeah, so maybe center that more. Not a big deal, yeah, not a big deal. You just touch that.
I did. I'm getting OCD right now.
No, don't. You're good. I got your back. Gotcha. You want to touch it and correct it. I got it. All right, we get to that point. I will start opening it up as soon as you get into that field, and let me know if you have some. I know you're going through. You're tired. You been working a lot. Okay. All right. I will start opening up as soon as you get in there and start setting up. Okay. You got that ready? Good to go. Good.
You can start opening up. Right. Would you like to start opening up? Yes. These are my actually close, so I would.
When in doubt, we just get a new one, okay? But in this case, we're just going to keep moving, okay? I like you calling out stuff. I think we're good there. Yeah. Yeah.
Put the drape on one and the other stuff on the other. Just put it.
Going to double up.
You got a little stuff down. That's
What's that?
on the back table. On this too.
For who? For you? Yes, you can do that. Beautiful. I got a garbage right here, guys. We'll clean as we go, okay? Otherwise, we'll have to clean up afterwards. Outstanding. Yes, ma'am. Yes.
So Brad, I have a question. If it rips like this, can I come down?
Yeah, I mean, what are you opening? Yeah, I mean, it would never come in and peel it back, so do your best. Sometimes it's better if you wait till she gets in it and she can just grab it sometimes. But in this case, yeah, if it rips, we just said it's contaminated, but for shits and giggles, just want you to wait for her to get in there and grab it.
I'll just put this in.
Yeah. But just think about that in anything
And
that's
this too, right? I should wait.
anything that's hard to get onto the field, just wait for her to get there.
All right.
Yeah.
Yes, sir.
Because trying to get it to your field and it's flopping around is problematic, right? Just wait to that point.
All right. Yep.
So when in doubt, throw it out. But if it's below the field, which this is, I would consider that contaminated, right? So again, if this is floppy and hard to get to your field, wait for her to get in there, open and let her grab it, right? But if it's above the field, you're fine. If it's starting to dwindle down below the field, no good, right? An itch? What happened? Okay. Don't do that. But if someone saw you and called you, just break scrub and get another one.
Yep.
And don't try to give a rationale. Just say, brain fart, get another one, go get him. Got the muscles here? What's going on?
This to me. Huge. So you want to pull for your white to show, but show your fingers out. So your white part needs to show. Your cut. There you go. Fix it. You fix it. You didn't give me enough. You didn't look, look at it.
No. I will.
We keep the surgery. No.
Yeah. If you're scrubbed and you want to take it as notes, yeah, if you're sterile, let's say if you're sterile and I'm sterile, and if you spin now, it's still sterile, you can keep it.
So
For now,
it's tight, right?
yeah, real tight, got on the sides, and then just come straight in, right? And push your foot on that so it doesn't move. No, make sure you get in the hole there. Come down. Yeah, so do you see this area? Just kind of come down. Make sure you feel the bottom now go. Now just start going in. Grab it on and just kind of worm it on. And there's a little bump here. You feel this bump?
Yep.
You have to get over the bump. You got it. Perfect. Look at you. I have my own team.
Oh, sorry.
Sorry. I'll wait for you to get that reinforced on and I'll start opening, okay?
Yes. Here you go. We're gonna leave it like that. Because I can't go back. Nope. And this is literally. Hey, Brad. So she comes this something like this. She can't pull it because it's already off, right?
So if I was you, hypothetically, right? Okay. I'm not sure what happened. The goal is to, this is all sterile up here.
Yeah.
You don't want to move it around a lot. So we want to get this off the edge and you're like, okay, what happened? Can't go this way. But you can kind of come out like this a little bit. But be very careful if this is hanging off the edge. You don't want to pull it back up. So I personally, if this scenario, just leave it like
Just
this.
leave it? Okay.
And just, if it's not there, just kind of drop it back down there. Okay. If just make sure, I know, but this, you have to center this.
Yeah.
And the way you guys are folding it is not the way I would do it, because you're folding the back in your pack. Is that a 3/4 sheet? Yeah, I want to show you. So I'll get you another one.
I have one.
Give me a 3/4 sheet real quick, and I'll show you. I'll be yes, ma'am.
Right
I'll be
here.
right back. Just stand right
Sorry.
there. No strike through, no holes, no condensation. You are good to go. Indicator I see right there, and it's black. You see it? Ooh, that's true. Good point.
Oh,
Good. No, that's good. So this is like a timeout scenario. So this was your 3/4. This is how I was trained. Now, when you guys have that in your pack, this is just falling apart. That's all. So what I would do is try to find the center point.
Okay.
So not up here, not down here. One's not over here. The center of the table. Then I would go like this, just boom. I would just stay nice and centered. Go out to the side, drop it. Right. Drop it, right? Good. Now, I was also trained to go probably back first, so I would hold this here and just go, make sure it's not moving. Back. Back. Hold that there. Forward. As long as you're not going above the table or below the table with your hands. And just kind of go back and drop it. Now you can kind of smooth it out a little bit. That's better than trying to like fold it on and let it fall where it's going to fall. You're finding the center point, opening it up, and then just going backwards and backwards. So that way. But the problem is you have these medium half sheets in there. That's not the real world. You're not going to have those. You'll have a 3/4 like this. Okay. That makes sense?
Yes.
Or okay, make sure. Thank you. What's that? Yes, ma'am.
Thank you.
Yep.
I already got you another drink. Oh, thank you. Could you check the
I'm going to start opening. You okay with that?
Sure.
So, on here. There, yes. I mean, you need towels on the Mayo, but not a towel roll, because I want to set up differently. Okay. I'm going to put a blade on your Mayo.
Appreciate it, thank you.
This is 15 blade. And I'll put all your sharps there.
Just one square?
You can double up on that. Is that your saying for the towel roll? Oh no, or for the draping. Yeah, it's you need 4 of them, so 1 facing you and 3 facing away, something like that. I'm gonna have you grab these because it's a little easier to grab it, so if you don't mind. I got a pen rose. And then I got your 10cc hypo. Yeah, so you can grab all that stuff. Take it off. I would just keep it in one area temporarily. Make sure you get some towels down first. Come in. Hold on a second. Right.
I touched your finger.
Did you?
I did.
Okay. Well, then we would have to get new gloves, but you're fine. Good call. Like it. That's probably me more than you. You dropped something? You dropped these? Is that what you're calling me here for?
No, so I was still setting up all of these.
You setting up what?
I was still setting up how we normally would, or we just focus on.
So don't worry about the Mayo yet, but what I want you to do is, I'm just going to give you advice, set up like this.
Okay.
Sharp spots here. Put your kidney basin in the back, right, that's fine. Right, we're going to get some saline eventually. Put your laps right here and put your Ratex here, right. Gather all your sharps, quickly just gather them up. You get ready for a count where you're putting them where they're countable items. All right. Pen rows we'll put right into your saline. Any silk for here too. And then your hypo when we're ready. Just gather all that into this area. And then start doing a towel roll, bringing everything out and lining them up ready for a count. Does that make sense? Have you ever done a towel roll before?
Can you show me?
Yeah. Zoe, I didn't forget about you. So, yeah, go ahead. Yeah, so, here's how I would do a towel. You can do it many different ways, but I like to first look at the stringer, how size it is. So it's pretty much about that size. So I'll just kind of halfway it. So just go halfway, right? If you want to double up on it, that's fine. Smooth that out real good. I like to just tuck in the edges like that. Just like this, and then just slowly, tightly roll it. And then you just kind of roll like a burrito. So it's nice and firm, right? Take my finger out. Got something lying around. Then what the goal is to get everything out of here and then just start lining them up ready for a count. I want you to have everything ready to go for a count. Don't count it as a mess. Get everything out. Line them up. Line the forceps. Line the retractors back here. And let me know when you're ready for a count. Okay? And then we'll get to the Mayo later. No worries. Just remember when we just your placing when we're done here, we'll get rid of everything, the sharps, and we'll start. I will, yes, ma'am. I just multitasking. We have a 3/4 sheet here, I think.
Hope so. Yeah.
And I don't know who wrapped this. It's all backwards. Edit that off the video. There you go. Take it. Think. All right, good. And I got an extra gallon you want, or? Correct. And an extra gallon for the doctor, right? Alright, so again, get this all set up ready for a count. Just hold on to it, put it underneath your basin as an extra one. Don't throw it. It's still on the base. So you're good to go. Set your tray up so you're ready for a count, okay? I'll be back. How you doing, Paige? Don't fight with the tray. It'll win.
I've never set it up like that with this house. I'm trying to do what you showed us.
Okay, so I would take this out a little bit. Try to come as close as you can to the edge, like this part. And then get very little on there. Just kind of tuck that in on the sides.
Okay.
People are like, oh, can I hold my hand down here? I mean, don't get it all the way down there. But just go into the edges like, and then smooth that down. Are we in there? Yeah, we're good.
Okay. So, will her trash on there? So she can't get it to me, right? How will we get that off there?
So let's say if I was her, I'd be like this. Like, you take this from me?
Good.
All right, that's how you do it.
Okay. I just want to make sure.
No worries. Oh, someone's calling me.
Her
Who's calling me?
Shit.
Danielle. Nice. Wait. I'm counting with you.
I just started doing it, so. No, I was just looking at it because.
All right. Okay. Let me know when you're ready for a count, and I'll come do it because this year I didn't do it week 1 with you. Okay.
Thank you.
Okay. Give me 1 second. Are you ready to count? What's wrong?
The mask is coming down.
This mask is falling down?
Mm-hmm. There we go.
Then just pinching here a little bit.
Hey, Brad.
I'll be right back. You're looking good. I want to count with you. Yes.
Can I show her the double tower real quick?
You can, yes. This is all learning experience. Are you ready for a count?
Yes.
Okay. Can you do me a favor? Can you go to Zoe and get through a count with her?
Okay.
And I want to do a chest card because I need to see her. I've seen Zoe already. So, what tray do you have? You know the top of your head, Zoe? Tray 1. Chest card, we have 2?
Yeah.
Okay, give that to her. Already is yours. So what I want to do is total count, not individual instruments. So if there's Ratex, let her go through that. Are you ready? What's that?
What did you say?
I say I want to go through the total amount, not the individual name. So if I said, how many forceps do we have? Just count how many forceps. And we'll start with Ratex and soft count and then move into the hard count, okay?
Yes,
Let her know if she makes a mistake on anything.
Any laps?
We're going to go with laps first. Are you ready?
Yes.
Okay. We're going to go with laps first. Are you ready?
Okay, I'm ready.
Let's do it.
Okay, laps. 1, 2.
Count to the table like cards, okay? Like 1, 2,
Okay.
okay? And count in 5 in intervals of
So
5.
then what I start at my minute. Any card noise?
Start here, okay? So, and then go over there. But make sure you count so they can individually see them.
1, 2, 3.
Good.
4, 5.
Good. Ratex?
Great text. Yes. 1, 2, 3, 4. Any 5, hypos, 6, any blades? 7, 8, 9, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Outstanding. Okay, we're going to go with Bovie.
Bovies.
So I'm going to show you here. So when we're doing a Bovie count, you're doing great. I'd make sure this is ready to go and exposed. We're counting this, not the machine. Okay. So a good practice is not to break your holster like I did. Sorry. It's an old problem. Yeah. Get in there! Oh, bitch. Oh, God. Now I know why you put it in that way. Hold this. Only because it drives me nuts.
Okay, do you want me to 4, he says, 1, 2, 3, 4, 5, 6, 7, 8, 4 sets. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Yes.
So make sure we turn around and this is exposed. Right? So when we're counting, we can see the yank hour and the tip. So all you got to do is say one Bovie. I can see it and you can see it. Okay. Bovie tip. Got one. Okay. We're gonna go with how many sutures you have.
I have 1, 2, 3.
You don't count ties, so.
Okay, so 3.
We're counting the needles, not the thread. So it's free. You got it. Okay. One. Blades.
I have 1, 2.
You can use your pitcher. You can break a little bit. Take your pitcher up. I want you to replicate the Mayo stand based on the pitcher. Okay. Don't worry about aseptic technique right now. It's about. I know you need to use your phone. Okay. But you can set up that.
1, 2 blade.
1, 2 blade. Hypos.
I have 1, 2 hypos.
Okay. Penrose drain.
I have 1 Penrose.
Okay. Good.
Yeah, I think you don't have it.
We did hypos. We did blades. Ratex. We did like needles. We did. Okay. Good. We're gonna go. What I want you to do is tell me on your stringer the names of them from this way to that way. You can go ahead as fast as you can. Okay.
Okay. I have 1, 2, 3, 4 perforating outputs. 1, 2, 3, 4 non-perforating. 1, 2, 3, 4 mosquitoes. 1, 2, 3, 4, 5, 6 Kellys. 1, 2 Cokers. 1, 2, 3, 4 Alice. 1, 2 Babcock. 1 right angle. Okay, any 1 needles?
Those are both right angles.
Okay, 1, 2 right angle. 1, 2, 3, 4 needle holders. 1, 2, 3, 4 scissors.
Tell me this is. Yeah. Tell me the
1,
names.
2 mats. 1, 2 Mayo. Straight Mayos. 1, 2 sponsors.
And that's a curved Mayo. Yeah.
Oh, curved Mayo.
Okay. Good. Forceps names.
Forceps. I have 1 DeBakey and 1 smooth tissue forceps. And then I have 2 Hudson with teeth. I have a Russian, a Biko, and 2 Russian.
Okay. Retractors.
Retractors. I have 2 cents, 2 rakes. I have 1, 2 Army Navy, 1, 2, 3, 4 double-ended Richardson, and 2 Malibos.
Okay. How many suction do we have?
I have 2 suctions. 1, 2.
Okay. So it'd actually be 1, 2, 3 because these are 2 pieces. So you want to count them in the pieces, right? So.
1, 2, 3 suctions.
Okay, anything you want to add to the count? Outstanding. So we'll get some saline and some medication to the field, and then you, as soon as you do that, can spend some time together and set that Mayo up. You want to look at the picture? Go right ahead and do that, okay? I can help you. I'm back. We'll put this into your saline.
Okay.
It always goes. This is going to be your suction. We'll put the suction over there, but you can either leave it in there or put it on here. It's not a big deal.
We don't have Wheatlanders.
We don't have Wheatlanders? Okay, good.
Not in the show.
Don't worry about it. We'll admit it.
Okay. And then
Wow, that's perfect.
and then I can't.
So these are just 2 hemostats.
You don't have to worry about that. You need 2 rakes.
Beautiful. Gotta load that up with the 15 now. Just got it. So we're gonna go with these are 2 cokers. And then we're going to load up the tie and a passer on the schnitz. Sorry. Put it right in there. So a CSD question, pan row should always be lubricated in your saline. That's where it should be living in a little pool, sitting there waiting for it to be used. Hi. So we have, this is here, this is the, we have the cokers, and this is going to be right angle, and this is going to be the schnitz. We have these schnitz, or the tonsil clamps, these with the ties on it. Do you have your ties or not? Maybe somewhere around. Yeah, so,
The ties and you said which ones?
so we have one, do you have any, and then the right angle. So we have one schnitz and just one right. Just one. So then we'll put the right angle here, and that schnitz's going to go here with your. It's getting kind of big right now.
That's what you need.
I know it's your field. I feel like I'm setting up. Do you know how to load a tie and a passer? Do you know how to put this in a towel roll? Let me show
Yes.
you. You do? Okay. What happened? I'm sorry. I'm so anal.
You're fine.
That's good. All right. Looks better. I feel better.
Red.
Yeah, I know. I just want you to get set up, and then I would. So do you? So I wouldn't have opened that up all that way. Can you refold it back to where it was?
Yeah.
Wow, just like this, wherever it was.
Oh, just a half.
I know, but I like it just like that. Because whoops, I'm coming. So we're gonna go into here and then close it and then go like that. So what I wanted. So I'll just lay them in here, so a little bit part of it's hanging out, and if it looks like it's dead ends, just cut the dead ends off and throw that away. And then label whatever it is. But so this is a 4-0, right? So thin. I could show you. So I would just go ahead and take that little thing off. Getting hot? I'm sorry. I wish that maybe was check the air, turn it down. So get rid of that. So this is real small, so you don't have to really cut it too much. So I just lay it in here, shut it. So I know it's going to be sticking out a little bit, right? And then I would just close this up, so I have access to it and I can grab it. And then this one here for the, so I would, you can either put this as the free ties, right? That's fine. But on the tie and a passer, I would load this one up. And that's so small. I would always use 0. Now you know why. You're gonna load it. Oh, you. Why am I walking away with your lap? Coming.
So,
That's a long towel roll.
we don't have. I know, that's why I told her I did a long way. This is the Bonnie. So
That
we don't have
is-
rat tooth.
So that's use a Bonnie. It's fine. Use what we have because we have to
And then
improvise. So.
we don't have sins either, but
No sins, no
so we do
worries.
the Kellys, right?
You can do it with Kelly's. Let's just get some stuff up here. It won't be exact if you don't have everything.
Kelly,
That's fine. Did you have these all here? That's how you have it all lined up. Okay, good.
Yeah. Mixers, because we don't have a right angle. We do a mixer now.
There's right angle right here. Or you can use that.
Mixer, right?
Okay, use that one. Yeah, Rixer's, but not as 90
That's
degrees.
not a right angle, right?
They could be Mixer, Gemini, right angle. Most doctors, they're so similar. Just the way the
That's what I'm
degree.
saying. The right angle is like really sharp.
I know. It just.
Okay.
That's very good that you know the difference.
Is this
So we have 15 blade, Edson with teeth. We have a rat tooth. You don't have a rat tooth. The DeBakey, medicine balm. Come. What's that? So it's in the thing. All right. So I know you just have to try to make some room here. And that's fine, as long as you know. So is this how you're going to go to the field? Yeah, so it's ready to go. You can just grab it, give it to them, load it up. I like to try to keep it on here maybe. But see, it's so crowded, right? So
what if I move those up?
yeah, you do it. Just make it's your table. So make sure you can move it around, have this laying out. I like to lay that right on top of that so I know where the free ties and the tie and passer is. It doesn't have to be exact by the picture. I just want you to get comfortable with what your field's going to be set up with. Okay? And that's the key. Could be 100 different ways.
So for her silk ties, should she already preload them?
Say what? 15 blade? What?
Silk ties, should we already preload it?
So load it up on that tonsil clamp and have some free ties already and a tie and a passer.
What did you guys?
And if you have ties, put them in the blue towel.
I'm
Remember?
not
Yep, yep.
Yeah.
Looking good, man. I like it.
And the clippers. She's doing hers. I'm gonna get your towel. Thank you. Cool. You want 15?
15, yeah, please. You got a whole selection of them, yeah.
I know, because I didn't know I'm supposed to.
I know, but that's not how it is in the world. You won't have blades in your sharps like that.
So these are for your free ties. Or your ties.
No, I think it's a tonsil.
You need some help? Don't mess your.
Is
your
that
string
right?
up.
Picture any tonsil.
So let me see here.
I have two
So,
right angles though.
so load it up on a right angle. That's fine because that's an option. Doctor's preference.
This was what I was trying to tell you before. Mine like all mixed up. I don't know who used it last.
Someone sabotaged you.
But they did.
I'm so like this drives me nuts. I want to. It just drives me nuts. I have to. I'm like, oh.
Go ahead. It's driving me nuts too. 'Cause it's not
Ow!
correct.
That hurt. Not in the order. Just it looks like it's a hot mess.
Yeah.
This is like backwards.
For this ties, can you put it in a cooker or it has to be a needle?
It needs to be a schnitz or a right angle, or in your case, a mixer.
That's okay.
That's fine. Yeah. Okay.
Yeah, so you'll preload.
You said I can tie the right angle for this.
You can.
I have cooker.
When you're doing ties,
Cooker.
is that what you're talking about?
Using the right angle because I don't have a tonsil. I don't have whatever you have to tie in. I don't know what that last one is.
I'm coming to help you as soon as I fix this.
This picture is very blurry.
It's all right. Here's the deal. I want to tell you, I'm going to let you do it, and it's probably some good things you can do out in the field sometimes. If you get a field that's set up, take some pictures of it by asking first, and then maybe when you're at home or here, print them out. But even for your final evaluation, if I go through the walkthrough and this is the final product, take a picture of the Mayo, and then we can print it out. When you're ready to set up, stick it on the wall. A little tape. So as you're setting up, all right, that's what I need on there. It's a little bit larger picture. I used to do that all the time in orthopedics. Like I was like, I can't remember all this stuff. So I have like 200 pictures in my phone. I would take pictures of the ones I was complicated with, and there was nowhere around. I would just stick it on the wall, scrub in and set up, and then I can just like, okay, it's that. And
So you can have your phone in your pocket? I thought I stayed in the locker room.
an extra ship?
Yeah. What happens?
You don't have to keep it. Just don't take it out
Well, I know.
during out. But I don't want you not to have your phone in case because people have kids and what if something's happening, right? I don't want you to take it out unless it's an emergency. Or if you're trying to take a picture of it with permission of the person.
Okay.
Patient in the room, don't take it out at all, right?
Yeah, you don't want to take it off like selfie.
Now, if you're going to misuse this, I'll say don't bring your phone. But I know we're all adults here,
Okay.
so
Yeah.
because we're living in a world where we can utilize it for education, right? And I know me, if I don't have my phone and something happens at home and I don't get a call, yeah, it's not right, right? My wife would kill me, right? You good? You feeling comfortable? You want some medication to your field?
Yes, please.
We're going to admit it on your side, okay? But you got the idea of it.
Yes. Put it in.
Should I load up another blade?
We want a 15 blade, that's it.
Okay.
Okay? How you feeling? Looking good?
Here.
So
With
leave
the
it.
medication.
Leave it right here for right now because sometimes they don't have the local right away, but you know where it lives. If you need the local, you just grab it, right?
Okay.
So
So then for my ties.
So if you did your ties before,
No.
do you have an extra blue towel I can borrow or no? I don't see one. Do you have an extra blue towel around here that you can find? Just go, there's a bunch in that corner over there. I'm going to show you. So your ties, I'm going to show you. This is obviously a 2.0 silk, smaller than the ones I had over there. So we're going to take that out and throw this away. All right.
There you go.
Don't open it. Yep. Thank you very much.
Cool.
So if you have ties, make sure you have extra blue towels. It's always good to have extra blue towels, right? Just stand pretty and I'll come look. So when you're doing your ties, Jessica, you want to open this up, right? So we know this is the halfway point. You just grab that point. You can take this off.
And you keep it up.
Right, we can throw it away. It's fine. Make sure you have the halfway point. Just kind of just this. Tuck this one in. It's fine because it's going to be sticking out
Okay.
just like that. Okay. And then we're going to close this. And then we're just going to. And then you're going to label this what it was, which was in my pocket. It was a 2O silk. So put 2O silk right here. You don't have to. You can just write right on it.
Yeah, right? Look at you over there, all these drapings all organized and fancy. Love it.
Good. So then, any place here where so we're gonna put this right here. So you can move this around so you have room. Make sure things fit. This is your table, right? Make it pretty. Me, I'm so inattentive. I like moving things around. Now this is hanging off a little bit. I don't like it. It's fine. Now the tie and the passer. Where's that mixer? Right here. So load one of these up on a tie and a passer, and then lay it right here. So the string is just kind of coming like that. So you're ready for a tie and a passer, and if they want a free tie, they can just grab one.
Now, how far should I load this?
So have you ever loaded one of these before?
Not a tie.
Okay, so this is called a free tie or a stick tie. So I usually just use that as some contrast because it's hard to see.
Yes.
And of course, I'm shaking because I had all caffeine. So this needs to come right.
So that caffeine, Brad, you're missing it.
Let's get a bigger bite. Oh man, so and a schnitz or a tonsil plant would be the same thing. So it's coming out right on the end. So if you pass it right, it's the same way they can go around a vessel. So I just have one ready to go. I know it's a lot of string, but just make sure you don't get snagged on anything. So you're ready to go. This is the right angle in case they need it. You got a 15 loaded up. This is their extra one. So just make it pretty. Organize stuff. Are you ready for the doctor? You got ready to go. You're looking good on your Mayo. Looks good. How'd she do?
Good. We're good. Getting the ties figured out.
Well, look at what's going on with that blue towel. Oh my gosh.
Oh, sure. You're just like so excited. I
What's going on there?
Okay, she's trying. She's trying. It came apart.
Oh no. It's like a hot
She
mess.
needs help with that.
Just let her. Can I help you?
Absolutely.
Absolutely. Please, Brad.
Please.
I was gonna say something, but I was like, "Don't say it, Brad. Don't say it." All right.
It looks like her. Oh no.
She said it. I understand. So this is a hot mess. So you want to try to get this as uniform as possible. So how is that going to happen? Do it carefully, I guess. So don't let this happen
Okay.
because you need to be organized with this. It can't be like spaghetti.
Of course.
That was like my hair.
So all this time you do this before the patient's in. Even if it's not uniform, we can cut the dead end, so to speak.
Okay.
And whatever the size this was, I think this was a. Let me see that thing. So, all right. So I want you to hold it just like this. Don't let go. So this, I don't ever want to open up. So is this one you're using? So I'm just going to rewrap this. So I like it to have it where you don't open it up.
Okay.
And you stay into that point where you're like this. So like, it comes this way. So just open this up like this. All right, now lay this into here. Find the halfway point. Okay, so we have a lot of hanging out here. So we're going to go this way, right? So we'll pull it to the end. Okay, we'll leave it there. We're going to cut there, right? Because there's a lot of, we can probably twist this in like that a little bit so it's not hanging out. And if you want to get a scissors, I'll let you do it. Right? Just cut this so it's uniformed.
Okay.
So it's nice, probably about that. But don't pull it out. And just throw the other excess out. Does that scissors work? Yeah, it's perfect. Right, good. So then you do that, right? And then you just kind of close that up. And then whatever the ties were, right, probably come out a little bit more. You can just label it 2O silk with a skin marker, right?
Okay.
So you know what it was?
The little metal piece is inside the blade box.
It's 2O. Blue dude, and it looks like silk, so it's 2O. I mean, it doesn't have to be perfect as long as you know. Wow, someone's spacing. Now, if you had another one, you can have 0 down here, right?
Okay.
So if you had another one going the other way, so sometimes you have. So this can go right on your Mayo. So this is going to be your right angle, so you can have it wherever you want to put it. So it's getting ready. I'll let you figure out where you want to put it. It's your Mayo. Looks good. Both of you.
Yeah. That I would have forgotten.
So grab a gown, grab your gloves. We're all going to get in here. Are you okay? You getting hot? Can you hang in there for a couple more minutes? Because we're going to.
Off my feet. Cool.
I want to use that Mayo in this setup. So what I want to do is just kind of push yours off to the side. Now that I don't like it, can we use one?
Oh, that's okay. I'm proud of it.
You did great. Do you want to take a picture of it? You good? It's up to you. Yeah, of course you can. But we're gonna make room for Zoe's table to come on over. So let's go over to this side, and we'll move this out of the way. You correct? Yeah. Is it for what? Yep, sure. I'm sorry. You need to open up either on. Just open up on there. You're fine. Well, not a trash can. That is not fine. There's a Mayo right there. Oh, Anna.
Yeah, that's so sterile, bro.
I'm like, yeah, just hold on there. So let's wait for a minute before you get to the field first. We're just, yes, ma'am. And we'll use your setup on this side here. Is this your, yeah, this is yours, right? Yeah.
I don't know what. No, mine's the over
So chest car, don't break.
No, I'm not ready. Just put it in my phone.
All right. Get in there, and then we're gonna. Once we start going again, I don't want anyone to be contaminated. Okay, right now I understand you're taking pictures and you're getting comfortable. So we're gonna use your field. I just want you to sit pretty and hang in there. We're gonna use yours for draping. Okay, you two are gonna drape. Are you guys want to drape right now? All right, so let's do it.
And you said
We're gonna use this setup. Yes, I always want. You can take off to the side. I know. Yes, down sheet, square off, drape. You can get a drink of water, but don't break scrub. I mean, like, don't take your gown off. Yeah. Just be aware of your back, Zoe, too, a little bit. That's all. Just trying to make it aware of you.
I'm sorry.
Just be aware of your back. Sometimes when you're backing up like that, you'll contaminate your field.
Like that?
Yep. So the idea is, where's the prep line, right? So like right here. So this needs to come out about right here and then over the feet. So yeah, good. And let's say commit to it, right? You're good to go. So if you have exposure of towel, we just need to put some more blue towels over here. You can't be moving this, right?
Right.
So you said there if you wanted 2 towels? Circulator. Can you please help me?
If you have extra ones.
I do.
Where I'm good with
20 towels right now.
We're gonna square off with 4, but like I said, if you have, let's square off first. And if there's a little white showing, we can put some towels on that, okay?
I only made up 2 because I thought you said these 2. I'm sorry.
Oh no, we need 4 towels. I'm sorry, dude. I failed. I'm just too many places.
Right?
Oh God, I gotta stop. There you go. Get in there.
He said 2, 2,
2. 1
facing.
Yeah. Everyone needs to sign in.
Well, you told me.
Don't raise your hand. Be careful. Don't hit your head on this. And stop talking back. I'm just joking.
So you're gonna start going upstairs by you.
Let's get in there. So I missed now. So let's start from, let me just hold this. Only because I didn't see what you guys did. So give me these. We're all 4 of them.
Right there.
This is your table, right?
No, this is for hers.
But that's my
I
towel.
didn't make 4.
Okay, whatever table we're going to use, in this case of the 4 towels, we want to, we have 1 to me and 3 facing away. But I want you to carry it up to the field. So one person is going to do it, right? Oop. So, but I want you to carry up to the field, all 4 of them.
Okay.
So if Zoe's going to do it, right? Zoe, go ahead. And I'm going to come to you. You're going to grab the first one, right? Right. You're not going to be able to do this. Doctors will do it, but you can't come up with one. You need to have all 4 in your hands, and then I'll let go.
Like that, right?
Correct. And then you always want to do it closest to you. Just remember, use this hole as a guide. So come on in where the edge is going to sit right here. So we have the exposure of the incisional side. Good. So then Cheska, you want to take over? Here's another one. So you can have, you're just holding them, right? Good. Welcome to the world, just standing there. And then give it to her, oh, and she'll come up across here to the top, right? Good. It's fine. Just, you don't have to throw it there. And it's not like trying to throw it. So be aware of this because people just come up like this. There's a little bit of bending. So see my hands? You tuck in like this, and you're just coming in, right? And you're just laying it there. Can you push it towards the incisional site? Yes, you can. No, I'm sorry. Can you push it towards the incisional site? No, but you can push it back a little bit. You're fine, or tuck it in, right? Good to go. Or if you want to tuck this in. You never want to push towards the incisional site. You can tuck down. Now we have our fenestration window. Let's get the drape.